Hello and welcome to week 40 of Bariatric Bloke, checking in with this week's weight following 40 weeks since my SADI-S bariatric surgery at Wentworth Douglas Hospital. And today's check-in weight is 264 pounds, which is 1 pound lost since last week's check-in. But the great thing about this week's check-in is if you do this in old money, that is a loss of 10 stone, which is 140 pounds, which averages out at 3.5 pounds a week, which I think is pretty amazing, pretty incredible. And if those of you that want to see it in a chart, here we go. We'll go to my little tracking app and we'll go down and we'll say give us it a 1 year view. And there you go. It's a pretty steady line. Although if you were to go the last 90 days, it kind of, well, it's still been going down, but it definitely has slowed down the last few times. But that's pretty good stuff right there. So that's been good to hit that number just as a kind of like mental milestone. But as you know, I've already gone past what my personal goal was anyway. So I have no complaints even about the slowdown. So that's all well and good, but what about the underlying medical conditions, which were the reasons for having this done? So this week I had my kind of like 6 monthly check that I would have with my PCP, my primary care physician. Anyway, in England, obviously a PCP is called a GP. And we can actually bring up my test results, the blood test that I had done earlier this week. And let's bring those up here. Let's get to the right screen. And why is that not showing properly? There we go. And then we'll transition to that. So if I bring up my A1C test, which is the all-important blood pressure test, you can see that this number is 5.4, which is great. No problems, totally in the green. And for those of you that are interested, this is what my A1C was on previous blood tests. And if I actually show that for all data, you can kind of see wasn't good. Right around here is when the surgery took place. So you can see just a dramatic decrease in my A1C. And these high numbers, by the way, that was with injectables, that was with medication. It just wasn't, and that was even with a, I think it was right around here. I did my 6 months with no sugar, and my numbers went up. Um, and so those results are great. Other test results that I had, because just general kind of like blood work done. CBC, no idea what that stands for, but you can see every single one of these is in the green, so that's all good. And if I go to my comprehensive metabolic panel, these are all good. That one's a little low, which is to do with muscle proteins, I think. And these are liver tests, which are high, but this is considered actually normal for the moment following surgery, and they expect that in 6 to 12 months these numbers will actually come down into the green as well, so nothing really to worry about there. And then I do have coming up actually tomorrow, I'm going for an ultrasound down at the hospital, which will be on my gallbladder. And that is basically a preventative thing that they're doing just to check that there's no gallstones forming, and I guess to check your gallbladder is okay. And if there's any issue, then I guess they will whip that out. But I think they like to spot any issues before you get in any serious pain from gallstones. So I'm totally fine with that. So talking of what did I just call that? What the hell's the name for the thing? Hold on a minute. I'm gonna have to look at my visits to get the name for it. Ultrasound. I did have an ultrasound done a couple of times in the last year for my bicuspid aortic valve, and basically, previously, whenever I'd have that done, I would actually have to have a dye or kind of a dye thing injected so that it would actually show up easier for them. Because when they were going through the fat under my arm and at my side to get to that, it wasn't a clear image. The last two times I've had that ultrasound, I've no longer needed dye because they've been able to see it more clearly without having that fat there and things. So anyway, so yeah, medically everything's pretty good, no complaints. Everything's going, I think, at least as well as, or not better than planned. So there's no complaints from me at all. So I did get a question this week, which is: I have spoken often about protein in my diet. What nutrition supplements do I need to take? So this is something that they kind of tell you before you've even had surgery, or long before surgery, is that you're going to basically be on some vitamins for the rest of your life. And my didn't really have a problem with that because I was taking so many medications anyway. Oh, and actually, talking of medications, my blood pressure has been getting quite low, so we're actually cutting in half my blood pressure meds. So I was on 10 milligrams of amlodipine a day. That's going to get halved to 5 milligrams. And basically, I just have to remember to keep smashing that pill into two pieces. And we'll see if it stays low, and if eventually maybe you can get off it altogether. So that's good. Anyway, so back to the question about vitamins and things. So this is what I currently have to take every day. And obviously everybody's unique, but there are certain things that are common. So let me bring up this window, and we will, this one's moved as well. We will transition to this. So I have to take one of these a day. This is a multivitamin, and this contains lots of vitamins and minerals and things. And this one's actually intended for SADI-S patients. And it's a little different than a regular multivitamin because I think the numbers are a little higher in it because our bodies can't quite absorb things the same way because of the upper digestive system kind of being disconnected and my stomach being connected further down, my duodenum and stuff. I don't know. There's medical terms, but basically, the top half of my intestines isn't really used. It's kind of sitting in there like the guy you see at a second-hand car dealership that's flapping about in the wind with a air thing blowing through it. Which I always wonder about. Can it ever like flap and get stuck in a knot and things? I don't know. Or is it actually stitched up somewhere? That's something I'll have to ask the surgeon. Anyway, so this one I take once a day. I actually take this in the evening, and then you can see none of these things are typically cheap. Then the other thing I take is I have to take calcium citrate, which is calcium, and I actually take 8 of these a day. I can reduce that a little bit if I have one of the protein shakes that has a lot of calcium, but calcium apparently is hard for the body to absorb, especially when it doesn't stay in your system for long. So these I take more than like the recommended dosage, which is 2. I'm taking 8 of these a day. And the best way to describe these is they're like they got the texture of like Refreshers, which is a candy in England. In the States, you'd compare it to like a Smartie or a Sweetheart or a better made Necco wafer if you're in New England. But so I take 8 of these a day. I have low vitamin A, so I actually take a vitamin A supplement. I take one of these each day. So these are 10,000 units a day. Fortunately, these are actually pretty cheap. And then I also have a iron deficiency, so I take one of these a day. So that makes sure I'm getting my iron, getting my vitamin A, get my calcium, and get all the other vitamins and things. And still, obviously, that big focus on protein. So basically, what that means is that my daily thing of what used to be a lot of medications a day is now just 2 proper meds, which is my amlodipine and atorvastatin, which is cholesterol one. And then the vitamin tablets and the calcium and things is what the daily occurrence is. So yeah, things still going well, still no complaints. This week, the weekend, I went and did a kind of like mini 2.5 mile hike that I used to do, a place called Stonehouse Pond in Barrington, New Hampshire, and I'd be pretty out of breath before when I'd get to the top of that because it was quite steep. This time, my heart rate never went above 110 beats per minute, and I wasn't really out of breath when I got to the top. And it was no trouble at all doing that little hike. And I thought that was pretty good. And then somebody pointed out, well, I didn't have a 140-pound backpack when I did it this time, which is true. And as somebody else said, if somebody had said, "Oh, will you carry my 140-pound kid up to the top of the mountain on your back?" you would probably be out of breath. So, um, yeah, so that was some good non-scale victory this week. If you're wondering, I have bought some new shirts because when I saw the photos from Europe, all my collars in my shirts were down here somewhere. Um, so I went and bought a couple new shirts this week and some trousers and so there's a couple of sweaters. So if anybody's looking to stock to buy some coals because I think their stock's going to go up based upon my purchases. But anyway, that is it. That's week 40. Still progressing, still going good or going well, if I want to speak English properly. And thank you for watching, and we'll see you next week.